So good afternoon, everyone. Welcome and thank you for joining us here at EMIS Live, the new normal. My name is Jamie Cole and I work within the EMIS Partners team. And I'm delighted to be showcasing one of the great partner products that we have that adds real value to your organizations and is now available through your EMIS account management teams. In today's session, and in partnership with SymlConnect, we'll explore how using their integrated solution, clinical staff can continue to engage and monitor patient conditions remotely, saving time and prioritizing those who need help faster. Just as a reminder, attendees on this session will remain on mute throughout the webinar, but I'm not alone on this end. Sabana, who is the CEO of SymlConnect, has joined me and is very happy to take your questions. To do this, simply type your questions into the message box. I think it appears in the right-hand corner there. And Sabana will try to answer those as we go along. But of course, we'll follow up with any that we don't get around to in the time that we have. So up until this point, paper-based forms have been issued during practice visits or clinics for a range of conditions and reviews. And as you know, we're all trying to digitize and remove paper because it presents a number of challenges and costs. The costs of and time spent printing, photocopying. Once you've received the completed forms, you then need to read and interpret the handwriting. Large amounts of time spent scanning that information back into the patient record or even coding it back into the patient record, requiring clinical personnel and a potential for errors in doing so. It's also unlikely you're going to be able to receive that form back and have it coded back into the patient record in time for that consultation. So you're missing a lot of that information prior to the consultation visit. You then need to shred, store or dispose of that paper. It becomes very difficult then to search for that information if it's held in a paper record or indeed scanned into your clinical system. And you're missing opportunities to capture a lot of that untapped data. So this process is heavily dependent on paper, requires a lot of manual input, and sometimes is just not collected at all, leading to a backlog in patients that potentially need your support. So what SymlConnect does is it removes this paper trail and saves time. And on this screen in front of you, you can see all the types of surveys that you can manage. Status, population health, long-term chronic conditions, at-risk assessments and screening. So there's a huge amount that you can digitize through SymlConnect. To give you an example, one of the cancer screening specialists said that her time with a patient is generally 30 to 45 minutes. So over a 3-hour session, she manages to consult with 5 or 6 patients at the most, because she's capturing that information back into the clinical system during that time. But if the patient had completed that form beforehand, she believes that she could see up to 10 patients in that same 3-hour session and indeed reduce the number of patients that need to be seen at all. And now, of course, in the current environment where patients may not be visiting practices or clinics, this information is taking even longer to collect via telephone calls. So if on average a practice may have 5% of their patients with asthma, so that could be around about 400 patients, and really what you're looking to do is identify that 5 or 10% that need immediate action. So that's sort of 30 or 40 patients that you need to see that need some form of intervention. Currently, using just telephone calls to run through those surveys, it could take up to 8 full days to complete that. And this also applies to most long-term chronic conditions that you manage under QoF, as well as a lot of the clinics that you run. So SymlConnect have developed a number of products that are now integrated with EMIS Web. I'm going to show you 2 of the modules shortly. The first one is called Patient Plus Remote. As the name suggests, it's used to monitor and engage with patients remotely via email and SMS. And the second module is Patient Plus, which is then used by patients through their own mobile phones when visiting a surgery or clinic. So now that the scene is set, I will just load up this presentation now, jump into a demonstration, which will show you a little bit more about how SymlConnect can be used to digitize those paper forms and free up your time. So the first step is to log in. Very similar to EMIS Web. It's no need to recreate or remember any other passwords. Next, you'll perform a search for a patient, which again works very similar to EMIS Web search with all the fields that you're used to, name, surname, date of birth, postcode. You can also build up your own regular list for specific conditions or patient cohorts. Once you've selected the patient, you simply tick the required questionnaires and send. The email or the SMS which goes to the patient will have any practice-specific content and your contact details added on. The patient then clicks the link on email or SMS. They're then asked to enter their date of birth as the second part of the verification. And of course, it's checking against the practice register to make sure those match up. Once they're logged in, all the patient needs to do is read through the questions and click their responses. You can see we've added in a back and next navigation buttons, so they are there to help support patients, and obviously if they want to review any questions before submitting, they can do. Questions don't need to be yes and no, they could be a variety of different types. They also don't need to be sequential, so we can include branch logic, which is supported as well. When they've finished, they submit. Now that link sends over to the practice. They can't come back into that link again and complete the questionnaire unless they're requested to do so. The patient responses you can see now in EMIS Web have been seamlessly updated within the consultation page. And all that data is then automatically coded with SnowMed codes, no further entry and easily searchable. Once the data's in there, you then have access to an analytics dashboard, which presents a simple visualization to identify those priority patients for early intervention. This is an overview of all responses, and clicking on any one of those coloured sections of the pie charts actually drills down into the individual responses for that particular question. And specific patient responses are immediately available once the patients submit their responses, without any further need to manually input or scan those responses in. And you can see here there are thresholds, red, amber, green, RAG alerts that you can enter in for at-risk patients, which are all configurable by the practice. I'm just going to pause the demonstration at that point, just to recap. So we've just looked at the Patient Plus remote module, which has been used to send surveys to patients remotely via email or SMS. But I'm sure if we sort of look back in to a few months ago, we can all remember a time when waiting rooms were full of people. And you'll also recall looking around that waiting room and seeing people with mobile phones in their hands. Some practices have procured expensive kiosks to help patients at sort of check-in time, but they can really only interact one at a time at that kiosk, potentially creating a queue at the check-in desks. There's also improved connectivity and Wi-Fi throughout practices, and this is often seen as a bit of dead time for patients that are waiting in the waiting room. But it does present a perfect opportunity to unlock some of that patient data with preemptive clinical questions, all of that time while they wait in the waiting room, and saving time during that consultation. So patients visiting a clinic can use this on their mobile phone or indeed a practice tablet. They simply scan a QR code through their mobile phones. It's a secure access onto the system. It can only be used while they're inside the practice network. Patient verification, which is needed to obviously ensure who they are that's logging in, ensure that matches with the patient record, and also to make sure that they have the right questions presented to them. If there's any specific or personalized notifications you want to send to that individual at that time, you can add it in as soon as they log in. If not, they just confirm, and they're presented with either the questionnaire or a list of questionnaires that they can go ahead and complete. Now, what you'll notice is, other than the screen size, because it's mobile optimized, the questions, the layout are exactly the same that they would receive in the remote process. They simply work through the questions, submit those answers, and it's entered into EMIS Web, direct from that waiting room into the patient record in time for the consultation. So you've got about a 30-second or so lag between submitting the questionnaire and it entering into EMIS Web. So once again, the information is there. The analytics shows various designs according to the types of questionnaires that are being dealt with. This shows the patient responses to support that clinical decision and all the protocols that you have. There's a simple mental health questionnaire analysis, which is just being shown in a moment. And these can be used for various screening questionnaires, which are highly valued for at-risk assessments for long-term conditions. Red alerts can be identified. You can define where those thresholds are, identify those at-risk patients, and they can be derived from either a total score or indeed from an individual response to aid the clinicians. Once you have all that data in the system from multiple sites, you'll be able to undertake some of that population health analysis over a particular region. So we know that the average length of a GP consultation is around about, I think it's 9.2 minutes, so call it 10 minutes. So we understand that your clinical time is precious. And another study found that the average GP consultation involves 2.5 health problems. So if SymlConnect can ask some of those questions and provide some of those answers prior to any consultation, perhaps some of those visits can be avoided, or at very least, the consultation can be focused on the actual reason they've attended surgery. So to summarize, and you'll notice in the bottom right-hand corner there, we've added in some QR codes. So when we send this out afterwards, by all means, use your smartphones to scan them and give them a try. But to summarize, there are really 3 key areas there where we believe SymlConnect can help. Firstly, in enabling practices to deliver more efficiencies. So by digitizing that paper process, reducing errors and integrating data into your clinical system. Secondly, by freeing up that clinical time to deliver more personalized care through patient-driven data and powerful insights. And lastly, by improving that patient experience through digital services and reducing clinical visits. As I say, by all means, when we send this through, have a go at using that QR code. It is, of course, not linked to a patient record, and it's outside of the patient network, but it will give you a view of what it looks like. So I truly hope you've found today's session interesting. I hope it's given you a flavour of the power of SymlConnect and what it can do for practices. Please do reach out. There's several ways to do that. There's an email address on the screen. You can go to the contact form, so click the link there for the contact form and fill it in. There's a bit more information around SymlConnect and the Patient Plus modules, or simply speak to your EMIS account managers. So all that's left for me to do is thank you very much for listening this afternoon. Wish you a very pleasant rest of the day. So thank you very much, and bye-bye for now.